Welcome back to This and That. Joining us today is Dr. Marc Fugate, vascular surgeon with University Surgical Associates, along with Dr. Robert Huang, cardiologist with UT Erlanger. And we're discussing, obviously, cardio and, of course, vascular screenings, how important it is. I was at the gym just last week, and, of course, this time of year, everybody's wanting to get into shape. I talked to, this guy was 54 years old, hasn't had any kind of screening, hasn't had any kind of physical for probably 5 or 6 years, he was telling me. And he's starting this pretty harsh exercise program. A little overweight, good idea, bad idea? When it comes to vascular, when it comes to cardio?
Well, cardiovascular disease is basically a buildup of cholesterol plaque in the arteries. From my point of view, it's the cardiac arteries or the coronary arteries that are very small, and they can build up plaque and then lead to coronary artery disease, and then ultimately could lead to a heart attack. People who are starting out exercise and stuff like that really do need, I would say someone who's that age, 50s, and just starting a pretty moderate exercise program are at risk for having coronary disease. So I would think that he would need to be screened.
Yeah. When it comes to vascular screenings, what's the difference? We hear it called kind of in the same sentence.
We always hear it the same.
Yeah, cardiovascular screenings, right?
When I try to explain it to my patients or my family, for that matter, what I focus on is all the arteries outside the heart and the brain.
Okay.
And so it's more of a broad topic as compared to what Dr. Huang does, just focusing mainly on the heart. But the reality is that our patient population is the same. The risk factors for peripheral vascular disease are the same as they are for coronary artery disease. So patients who are older, patients who are overweight, like the gentleman you mentioned, patients who smoke, patients who have diabetes, hypertension, high cholesterol, the risk factors are the same for both of our patients.
What are some of the symptoms that we're looking for?
So in my population, I would say the symptoms that we're looking for are mainly shortness of breath and chest pain, fatigue, left arm pain or upper extremity pain that can be indicative of cardiac disease. I think the major thing, sometimes though it can be even as atypical as heartburn and things like that. So I think if you do have cardiac risk factors, you do need to be screened and appropriately and get out to maybe one of these things that we're holding.
5.4 million Americans are affected by stroke. That's amazing.
It's a huge number, it seems like.
Stroke, particularly in this area, is a very common problem, and one of the peripheral artery areas that I deal in is the carotid arteries. Carotid artery disease is is the number one preventable cause of stroke. So if we detect people with carotid artery blockage, they can have surgery or endovascular interventions that can prevent stroke. But that's one of those things that you don't typically have symptoms until you're having either a stroke or a mini stroke.
Right.
So that's, again, it goes back to the importance of screenings, because most of peripheral vascular problems in particular are silent until they begin to cause really dramatic problems.
So it is so important to get screened. Thank you, doctors. Thank you so much for joining us on This and That. For more information, 423-778-LINK. And that is all the time we have for This and That.
Don Welch will be back tomorrow.